Okay, good evening, everybody. I'd like to call to order the Community Mental Health Full Board meeting for July 26, 2023. Please rise for the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Now we'll move on to the reading of the mission statement by Dana.
Macomb County, should I turn my thing on? Can you guys hear better?
Then it's on record.
Wait, what did I do? Now it's on, okay. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Dana. Yes, board members, please have your microphones on when you wish to speak so that it can be picked up for the YouTube video. Next, we will move on to item 3, adoption of the agenda. I'll take a motion to adopt.
Support.
Motion from Dana, support from Antoinette. Questions, comments on the agenda? Okay, seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak, you have 5 minutes. Just give us your name and where you're from.
Hi, I'm Nancy Workman. I'm from Liberties, and I'm here to give a report, which I haven't been here in a while, sorry. Lots of good news at Liberties. Our balance in our checking account is, at the beginning of June, it was $47,159.08. On June 30th, it was $49,550.82. We just received another donation for our savings account from St. Michael Church. So our savings account was $36.56, and we're adding $1,800 to that. So that was nice. We are now tax exempt. It took quite some time, but we are tax exempt, so I can now start fundraisers, that kind of thing. So I'm really excited about that. We've got 3 new potential board members, which I'm ecstatic about that. We need a board very badly, and so we've got Amber Oliver, Melvin Cavett, Fred Trudell, and John Murray has been our secretary on our board. So Amber was going to try to make it tonight, but she got stuck in the weather. And the same with Melvin, and Fred still was going to try to make it, so they might make it before the end of the meeting. In process right now is a computer lab. I'm excited for the membership. They can definitely use it for resources, so we're getting a computer lab thanks to Dave and CMH once again. I was talking with Todd from the WAVE program. He was asking if it would be something that Liberties is interested in. They have an opening on Tuesdays, so it is something that I'm going to run across the board and see what their thoughts are. But I myself think it would be a nice idea to service the people that are in need. So we'll see how that goes. I got a contract from Todd, is his name, for them to look at. Our average membership, April, May, and June, our north average per day is 14, and at our south location, it's 8. It's been very slow at south. I don't know why. The only thing I can think of is I kind of been cleaning house. I know that's a bad term, but that's kind of what I've been doing. So I don't know if that's why the membership has gone down or and staying down. I don't know, but anyways, we're doing meditation. Amber, the new the woman that would like to be the president, she is doing meditation at Liberties once a week, and she's alternating north and south. Haircuts, I think we've got another lady to do the haircuts. I was supposed to speak to her today, so I will get with her after the meeting probably. The second annual picnic that we had went really well, except with the, one, not one, but the young lady that was working at the ice cream shop that day her purse was sitting out and the bathroom was being used by the members and somebody stole $60 out of her purse, which is so unfortunate, but, we're replacing that. Other than that, though, the picnic was a success. August 29th, we're going to the zoo, and September 25th, we're gonna do some apple picking. Again, it was really fun last year. The members really enjoyed it, so we're gonna do that. We switched from Comcast to AT&T. We're saving approximately $300 a month by doing that, so we no longer have a fax machine, but we don't need it with scanning. The only thing is, I was gonna ask maybe for a scanner, or a new printer, because our scanner it's old, and it's very touchy. You gotta push the button to go a million times. I don't know, if we could get another, printer scanner, that would be great. Building, we're hoping to, move from south and have, I think I mentioned it at the last meeting, we're trying to have one location in the center of Macomb County and on the bus line. I've been somewhat in the process of looking. It's been very difficult, though. Our landlord at South, we don't have a lease at our south location in Roseville. John Ruffin, the landlord, wants us to sign a 10-year lease. The building is not a good building. For instance, when it rained today, the lights, I wasn't there today, but the lights probably went out as soon as it started raining. Not all the lights, just some of the lights in the place go out. It's just not a good building. So at this point, as far as I know, we're not going to sign a lease. Our building at North, the lease expires June of 2024. So therefore, that's why we got to get busy and look for a building, and so that's what we're doing. The landlord over at North did meet with me and Bruce and talked about remodeling the North location to accommodate more people. It was a nice thing. I mean, it was a good thing, but he came back with an offer that he wanted us to sign maybe a 10-year lease at that point. And it's not on the bus line, so we're thinking we still need to look for a building. I'm sorry, I'm probably taking more than 5 minutes. That's it. Thanks, everybody, and thanks for such a nice night on May 18th. It was wonderful. Thank you.
Thank you. Thank you for the report. Anyone else from the public wishing to speak? Anyone else from the public? All right, seeing none, we will close the first hearing of the public. There is also a second hearing of the public before the end of the meeting. And we'll move on to item 5. I'll take a motion to approve minutes of the regular meeting of the CMH full board held on Wednesday, June 28th, 2023. Motion from Selena, support from Mark. Comments, questions on the minutes? Seeing and hearing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Minutes are adopted. Item 6, standing committee meeting minutes. We do not have any at this time. We'll move on to item 7. Request to approve. First is item A. I'll take a motion to approve MDHHS agreement with MCCMH. Eligibility specialist position in the amount of $74,150, and this is a new contract, and it has been approved by legal. Take a
Support.
motion from Antoinette, support from Lori. Tracy?
You have seen this contract in the past in the way that we currently have Leanne Bomarito physically located at our administration location. She's a state employee who works for MDHHS, and she does eligibility for individuals. What's great about having her physically there is if we have a problem, she can look them up, she can answer questions. She's basically an expert that we can quickly access, which makes it easier for the people we serve or the case manager or whoever that is to be able to do eligibility for Medicaid. So this is just a continuation of that arrangement for her to stay with us. And we're paying for, as outlined, and there the wages are partially for the expenses of that particular individual.
Thanks, Tracy. Any questions, comments? Tracy's standing in for Dave this evening, so. Seeing none, please vote. Anybody? Sorry, I am brain farting right now. We have motion and support. All in favor signify by saying aye. Aye. All opposed. Motion passes and it woke everybody up. We'll move on to item B. I'll take a motion to approve the coordination of outside legal counsel for methadone payments.
So moved. Support.
Motion from Selena, support from Linda, and we will turn it over to Ken.
Good evening, everybody. As I've spoke to in previous meetings, the issue with the methadone payments is one of our ongoing disputes with the state of Michigan, where they have mandated that we pay $19 a unit for a rate, and we dispute the fact that they could put that sort of stipulation on us as a managed care entity. So at this point, the state continues to argue the issue. Richard, for the most part, is pushing back. At this point, we're looking to obtain specialized legal counsel as it pertains to this issue. So I think there's two firms that would be qualified for something like this, and looking to utilize one of them to get an opinion on this subject.
Thanks, Ken. And just a note that Dave did speak with the Office of the County Executive and Corp Counsel, and they did mention that this was okay to go forward with if we so choose. Any questions, comments for Ken? Okay. And also, if we do decide to go with a firm and we do decide to contract with them, that contract will come back to us for more approval. All right, seeing no other questions or comments, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thanks, Ken. Next, we'll move on to item C. I'll take a motion to approve the agreement between CMH and drwanted.com LLC Healthcare Staffing Service Agreement.
So moved. Support.
Motion from Linda. It's a tie between Antoinette and Dana. We'll go with Dana. She's sitting closer. Tracy, go ahead.
This is an additional agreement. We have 6 other agreements with organizations or called locum-like companies that assist us with finding specialized psychiatrists. It is a continuous struggle to find a board-certified child psychiatrist specifically. We have engaged this company just to further explore, and they've already been able to find 2 for us, which is very unusual. So imagine basically we're just trying to make lots of agreements with lots of people to ultimately get to the end result, which is our need to fill that particular opportunity. So it's not an agreement you're saying you're going to pay anybody, you're just saying you can work with this organization. They then send us that individual, we then go through the interviewing process, and if there is a match, then we move forward.
Thank you, Tracy. Nick, did you have a question?
Yeah, Tracy, I understand the need for psychiatrists, but this contract allows us or allows them to provide clients in need of locum tenens staffing services for physicians, CRNAs, nurse practitioners, physician assistants, clinicians generally. That's pretty broad. And what do we intend to use it for, number one? Number two, are we running afoul of any of our collective bargaining agreements? And number two, are we watching carefully, because this contract also requires that these people be general contractors instead of employees of either, was it mydoctor.org or whatever it is, or us, and we ran into problems with the IRS on that issue in the past.
So we have a very clear separation, so there should not be they are not our employees anyway. We do not treat them like that. We make sure we don't do their schedules. We don't have any contractual relationship directly with the individual in any way. The only thing that we have from that individual is the credentialing to demonstrate that they legally can provide those services. To your first part of the question, Although it does list those staff, we would only engage this company for psychiatrist, maybe an NP, and maybe a physician's assistant. We don't traditionally do those, but we are trying to explore that because there are more of them and they are at a lesser rate, but we don't utilize them for any of the other purposes listed there. As you mentioned, we have a direct collaborative agreement with the union to provide the rest of those services from a staffing perspective, yes.
You all set, Nick? Okay. Any other questions, comments for Tracy? Okay, seeing and hearing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item D. I'll take a motion to approve PAHP Amendment 10.
Support.
Motion from Antoinette, support from Lori. Ken, go ahead.
You're gonna hear from me a lot tonight. This rate amendment is specific to a rate increase. I don't believe there was anything else in there. I'll break it down into two parts. The first part being DCW. So the state has adjusted rates up to include more covered hours for those direct care workers, such as PTO, some indirect time, training and things, which took a while to get in there, but it's nice to have. So my understanding is they're gonna increase our rates for the last couple of years months of the year to cover us on that. As part of that effort, one of the things you'll see is a DCW factor in there. So again, this worked in our favor, but they weighted the allocation heavily to Southeast Michigan because our expenditures were greater than other parts of the state. So us and 4 other regions benefited from that DCW factor adjustment. And then the second piece was confirming our PPS 1 rate for the CCBHC program for fiscal 23. So $368.50 is our PPS 1 rate for fiscal 22, which is good. It's a little bit less than last year, but still on the healthy part of the kind of the spectrum that the state would guide that on. So
Thanks, Ken. Nick, go ahead.
Overall, this is a rate increase,
Right.
obviously, which is good from our perspective, but I did notice that on the CCBHC supplemental, there was a slight decrease in the rate. Now, I understand that's just for the balance of this fiscal year and that's going to change.
So actually, for us, we're in a unique position, as MCCMH and the CCBHC that we run. The supplemental piece of it has a bigger factor for those regions that have CCBHCs within their region and aren't like us, where we are ourselves paying ourselves, I guess, for this this program. So moving the supplemental, they essentially moved it out of supplemental and into base. We're getting the exact same amount. It's just what bucket you fund it in. And because we're lapsing a lot back to the state, it's not going to impact us in any significant way. So,
Thank you.
yep.
Thanks, Nick. Any other questions for Ken? Okay, hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thanks, Ken. Next, we'll move on to item E. I'll take a motion to approve MyCare Capacity Grant. Motion from Dana, support from Selena. Tracy, go ahead.
MyCare is our physical health provider or partner. Just as a reminder, they are physically co-located at our north location. They have submitted a capacity building grant. This went before the SUD board and they approved $15,000. They originally asked for 40, I believe it was 47, forgive me, I might be slightly off on that number. And we are asking you to seek or approve an additional $15,000 from general fund. So again, $15,000 from mental health general fund and $15,000 has already been approved by the SUD board and is bringing it for your consideration. In summary, if you look at it, they're asking for payment of furniture. The benefit for us is they're expanding an office, which allows us to have additional medicated assisted treatment slots for people. So individuals who have an SUD disorder and they are in need of medicated treatment. It also slightly expands, not by a large amount, but it slightly expands their ability to provide behavioral health services. So again, they were a physical health provider, but this allows them to expand in a little way to expand our provider panel for those behavioral health services.
Thanks, Tracy. Any questions, comments? Okay,
I just have a comment.
Linda, go ahead.
Staff, this is what we asked our vendor.
We're still working through it. All right. No other questions or comments? All in favor signify by saying aye. Aye. All opposed? Motion passes. For the next two, if nobody has a problem with it, I'd like to take them together. So I'll take a motion to, Nick, do you want me to separate them out?
No,
Oh,
that's-
okay, I thought you started. You look like you were thinking. So I'll take a motion to approve the Substance Use Division to issue the fiscal year 24 and 25 provider contracts to all current network providers boilerplate, and to approve network operations to issue the fiscal year 24 and 25 mental health contracts to all current network providers boilerplate.
So moved.
Motion from Megan, support from Selena. Tracy, go ahead.
So the reason why I wanted to combine them is I'm going to, otherwise I would repeat myself. So the reason why you have this before you, and you'll actually have items coming up, just to give you a heads up, and I'm happy to explain at that point. J and K, they relate in the way that the state of Michigan said to us, you must add delegation, very specific delegation language directly related to credentialing. So if we have a provider, we say to them, you must credential, AKA, you must make sure that this person has the proper licensure, they don't have any concerns in their background, and they're able to, at a professional level, provide services to the humans that they're providing. We delegate that to them to collect all that paperwork and do all that. Therefore, we must have delegation language in our agreement with them. So before you, you have the boilerplate, this one that we're talking about right now is the boilerplate language for the SUD services, the boilerplate language for mental health services for our main providers. And the only differences outside a few grammatical ones is that delegation language. And in addition to that, the state of Michigan added to our contract language about having to have access to records, the OIG specifically, having to have access to records for 10 years instead of 8 years. So you'll see those two differences. And then the only other minor difference, we're trying to transition from the MACOSA language to SUD to try to make us one organization slowly, so you will see that other minor difference.
Thanks, Tracy. Questions, comments? Nick, go ahead.
Yeah, I think you answered just about all my questions on F, G, J, and K, because I didn't object to combining them because the questions I was gonna ask on all of them anyway. The concern I have, and this is the procedural problem we run into because of not having program and budget committee review these ahead of time and seeing it later. But could you, but I understand there's some urgency in moving this, that this is not something we should delay for another month while we review it. So I'm not going to object, but I would ask that you provide us with redlined versions
For sure.
that show us where the changes are. And in the future, if you could do that when we have a contract amendment, because I'm reading the contract as amended, and I can't tell where the changes are during that whole time. So
Absolutely.
if you could provide that for us, I'd appreciate it.
Thanks, Nick. Thank you, Tracy. Any other questions, comments? Okay. All in favor signify by saying aye. Aye. All opposed? Motion passes for F and G. And we will move on to H. Take a motion to approve Experis Jefferson Wells 2023 SOW Targeted Compliance Audit. Motion from Antoinette, support from Linda. Tracy?
We are seeking your approval to engage Jefferson Wells, who is our current contractor who provides additional other audits. But we're asking to specifically do a specialized audit to ensure that all of our Medicaid funds are properly documented, spent as they should be.
Thank you, Tracy. Any questions, comments? Okay, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we'll move on to item I. I'll take a motion to approve airfoil amendment statement of work.
Support.
Motion from Antoinette, support from Lori, and I'm going to call up the folks from airfoil to present. Tracy's going to give a brief introduction, and then if we have questions of any of them, we can take them afterwards. So Tracy, go ahead and kick us off.
We have been engaging Airfoil after the successful RFP process that you guys approved well, and they were selected in order to engage us over the last couple months to look at us, evaluate us, make some recommendations. So today they are here to present kind of a little bit of their findings and how we think we can move forward successfully.
Thank you, Tracy, and thank you, all of you. It's nice to be with all of you this evening. My name is Keith Donovan. I'm the CEO of Airfoil. As Tracy said, our work kicked off back in April, and we were brought in really to evaluate the brand messaging of Macomb County Community Mental Health, as well as to put into place a marketing strategy to help elevate the awareness of the organization and also to further kind of engage the community that you serve within Macomb County and throughout Southeast Michigan. We have been hard at work for the last several months, and we've accomplished quite a bit over that time period. We have a very, I think, informed and comprehensive marketing strategy in place. It's in the materials that we provided to all of you. We are right now wrapping up and kind of putting the final touches on the next iteration of your brand messaging. And we've been working very closely with Dave and with Tracy throughout this process, and they've been wonderfully supportive and have provided us access to a lot of the resources and information that we've needed to kind of inform our plan. So you can see sort of on the slide in front of you that there's been a lot that has kind of led us to this moment and kind of where we are in this work right now. We have taken a very deep audit and review of your existing marketing materials. We've met individually with a lot of internal stakeholders within the organization to kind of inform our marketing strategy. And now we're really looking toward the next phase of that work, which is really the implementation and activation of that marketing strategy. And I'm going to introduce Angela Leon, who is a Senior Vice President at Airfoil. Angela has been really the project lead on this program and has been working with our team back at the agency to compile this strategy and this plan. She's going to share with you a little bit of the findings that we've uncovered through our initial work, as well as an overview of our marketing strategy and kind of what the next steps look like. Angela?
Thank you. Yeah. So first up, I want to start by just sharing some of our high-level insights from some of that work that Keith just discussed. And you'll see a couple bullet points here, but really it kind of boils into two main categories. Number one, I kept on hearing repeatedly, you are the best kept secret within Macomb County, which on one hand is a really nice compliment, but on the other hand, definitely presents a problem when you recognize that we want people to know who we are. And more than that, we want our community to be able to connect the fact that we are here with the services and the resources that we provide. So number one, a big opportunity for us to do a better job of just increasing the awareness, but also better connecting the awareness of the community mental health with the individualized services and resources that the community can benefit from. The second thing that we heard quite often is that community mental health as it stands is a complex, complicated, oftentimes frustrating entity for the people who need your services to really access and to navigate through. And so while there is a lot of information that is available through the handbook and through a lot of the materials through your website and some of the existing marketing, frankly, it's hard to find. Even if you know where it is, you might not know where to find it in the moment. And so there's a lot that it can be done, I think, to help to just overall set better expectations for what people can expect when they come through your organization and how to better navigate that situation. Which brings us to our strategic recommendations here. I'm actually going to start with on the right side, which is awkward, but we want to actually start by the people the people already being served by you, or the people who are actively seeking out services and seeking out your recommendations. What I just talked about is about the fact that it's very difficult to navigate your organization and the processes that are in place, which are in place for a reason, communications alone can't necessarily fix the complex structure, but we can better prepare those folks who are coming into it to know what to do, what to expect, what to bring, how to prepare, and to know what they are going to get out of that first call, out of that first appointment. That can, in and of itself, will alleviate a huge amount of frustration. And so you'll see here, a large part of our focus between now and the end of the year will really be taking a lot of the source materials that already exist and evolving them into new content and materials that are more easily digestible, easily accessible, and can meet people where they are. Just because I have a question, I might not know to go into my 80-page handbook, but I might come to the website and want to chat with somebody with a live question. Rather than being told to call another number, we want to be able to access that right there and serve them up with a checklist of what to bring to your first appointment, or here's what to expect with this particular question or form. And so through just some very simple content development, we can really help to, I think, make a big difference for those folks who are already trying to navigate the system. On the left here, you'll see 40% of our strategy and where we'd like to dedicate resources is solving that first problem and not keeping you such a good secret. We want to spread the word a little bit more throughout the organization, throughout the community. And so this portion of our resources and of our program will really be about spreading that word throughout the community through what you would consider with a typical advertising and marketing type of a campaign. You'll see here, and there's quite a bit more depth within the go-to-market strategy that you have in front of you. But really the point here is to not only raise awareness of the fact that you exist, we want people to recognize Macomb County Community Mental Health, but we also want them to better connect that to the services that you offer so that they understand when somebody might need specific services that they can come to you for them. The other thing that we heard quite a bit was some misconceptions about who is available or who is accessible to get those services. Some people thought that because I have private insurance, I am ineligible. Other people thought because I don't have private insurance, I am ineligible. So there are quite a few misconceptions that we can begin to break down with that as well. On the next slide here, sorry, you guys can barely read that, I'm sure, but what you'll see here is that some initial campaign concepts, and this is some rough ideas, but really rooted in some of the messaging that is being developed right now and being confirmed right now. That you'll see here, a lot of this is very person-centered, it's person first. It's giving the power to that individual to state when they are ready for those services, that they are empowered to make that call, and that we will be here to help them. On the far left, you'll see kind of our idea and core concept for a larger brand campaign that we believe can really help to do that and raise the awareness and better connect it to the services. And then on the right, you'll see two examples of campaigns that we think can, again, go even deeper into those services that we offer. We've chosen, ideally, mental health and SUD, number one, because there's some seasonality. We have Mental Health Month coming up in October. What a perfect time to really kick off this first campaign. But we also know that there are some available funds through some grants through the SUD that we need to take advantage of right now. So we've prioritized that before the end of the year as well. Finally, most importantly, how do we know that we are successful? You'll see quite a few objectives here, from raising awareness, dispelling some of those myths, really easing that transition and helping folks navigate the complex web that just happens to be community mental health. And really there are a lot of tools in our tool belt to help to kind of measure the success and the efficacy of our programs. On the right, you'll see here some common tools around traffic to the website, time spent on site, the overall reach of our marketing materials and the depth of the community. Some other things that we've talked about and we're starting to explore already with Tracy and Dave is potentially even some surveys. It can be quite costly to do an entire perception survey, but we understand you already actually have some surveys to the community that are already going out. So we're in the middle of kind of exploring where we can kind of set some of those benchmarks so that at the end of our program, or at least 12 months from now, we can come before you with some really definitive data to showcase how we've been able to move the needle on those, not just awareness, but also perception as well. And finally, very aware that I'm probably over my 5 minutes. Next steps, what you can assume from here, we're going to create all of that messaging that we are in the process of creating, and really making sure that that is first and foremost updated on your website. Your website is actually quite good, especially when compared to a lot of other community mental health websites. But there's definitely some work that we can do to infuse our new messaging, to infuse some more brand continuity within that website, and then again, begin to add more depth through that content that we can begin to offer, helping people navigate that system. And then secondly, we've identified the 2 campaigns that we hope to kick off very, very soon here. So that would be between now and the end of December, and then starting in January, just a continuation and rollout into some of the other service lines that we start to see. Any questions?
Thank you very much. Any questions? Nick, go ahead.
Two questions. There's a large amount of money in the initial cost estimates, and I understand it to some extent, although I'm a little concerned about the size. Although you guys have done great work, so I'm not complaining about that. But it's sometimes referred to in our presentation, in our packet, as an expense, and sometimes referred to as a retainer. I'm talking about
Yes.
$240,000. Is that a $20,000 a month payment, or is it a $20,000 a month retainer from which you draw down for the specific deliverables that are listed?
Hey, Keith, could you come up to the microphone, please? Thank you.
On the microphone. Yeah, so you will essentially be invoiced $20,000 a month for our services, for the core work that we are doing. There are a few other line items in that budget that pertain to one-off project fees or media expenses, but the simplest way to think about it is a $20,000 a month invoice for our services.
So it's not a retainer in the normal sense of a pot of money from which you draw down?
Yeah, I think that's accurate. We sort of use that language internally, but it's essentially a payment, yes.
And then you report back to us. And so this is a one-year contract? Correct?
Yeah, we have it established as a one-year program. There is a termination clause in our master services agreement that can be executed at any given point as well.
If we're unsatisfied for something?
Yes, I believe the terms of the master services agreement are a 60-day written termination clause.
The other concern that was raised as I was looking through some of the materials was that some of the materials that you're producing will be copywritten. Who will hold the copyright? Can we use them at will? Do we have to go back to you? What are you copywriting, and who owns
Yeah, anything that we are producing on your behalf is yours, and you own it. And so,
So we'll own the
you will absolutely own anything that we produce on your behalf. Yes,
if we choose to continue to use it beyond the contract period.
absolutely.
I am concerned with the size of this expenditure because it's higher than we usually see on something like this, but I think it is a very important thing that we do to reach out, and I want to talk to Tracy after the meeting about. But I understand there's some urgency to this as well, that we can't delay it. So is that correct? Because there's a lot. I mean, we just got this now, right? So there's a lot to go through, and it would be nice.
Sure. The reason why you're getting it sooner, Angela had mentioned we do have some marketing dollars, as an example, for SUD that have a spend day of September 30th. Also, we really would like to, Suicide Awareness Month, we really want to have a great campaign. So in order to do that, have the materials, start producing them, that's kind of why there's a timeline associated. It's really driven by those main 2 things. We continue to work with the county on having possible marketing support, but we don't have anybody. We don't have a body. It's me and Dave, which is really not a good solution, right?
We had a couple of people.
We did, and we
we
still are.
lost them. It sounds to me like the intent is to to take those dollars that we would hire somebody normally and put those dollars to work here for, no, with airfile and not hires, not fill that position.
We don't technically have a position that's a county position, to be specific. We're currently working with HR. We met with them earlier today on some other subjects, but essentially, we would be seeking at some point a communications supervisor, but it would really just be to be the conduit for these type of activities, because in my example, it's not a good idea to have Dave and I do this. So this company, we're seeking their expertise to build campaigns and give us some materials, because Nick, if there is ever a moment where maybe our funds do dramatically change, which, as you know, kind of ebb and flow, it would be very, it would be very advantageous for us to take advantage of while we do have the funds to create good marketing and content that can be used for years to come. So that's,
But what I'm saying is, we had a communication person,
we did.
and we lost them for different, they got hired away from us, basically. But we're not filling that position, so that frees up some dollars.
Yes, that position hasn't been filled for an extended period of time.
And
then-
that'll help cover the cost here.
It will, for sure, but we are ultimately still, it probably will take longer than we all hope, but at some point, we do want to have a contact person. It probably won't, it will not be a marketing director or communications director, which you guys are familiar with the past. It will be a lower level position that, again, kind of acts as a lead.
But as of right now, we're not filling it. And
Correct.
secondly, this is a one-year contract
Correct.
that can be terminated if we needed to, but we'll review it again annually with them, and which is an excellent presentation tonight. I wish we would have seen it earlier, but it's a very good presentation. Thank you.
Thank you, Antoinette, and then Linda.
Oh, thank you very much. I really liked what you presented. I understand who we are. You need to kind of dive into and find the good, the difficult, and kind of like what's missing. So I do appreciate the time that you have put forth into finding that, because to say like, you guys are great, no one knows you're here, is the truth. It's something that I think we've all talked about before. I know I've seen it, I post, and they're like, oh, where's that? Like, yeah, we're here. So I do love that you have taken the standpoint and finding who we are, and then next to find out how can other people know who we are and what we can provide. So I do like that. I do agree the presentation was great. I look forward to seeing what you have for us. I know it will be good. I'm usually a stickler with like marketing and advertising people, but this was great, and I really enjoyed it. So I thank you for partnering with us and coming before us today.
Thank you for the opportunity. Appreciate that.
Thanks, Antoinette. Linda?
I just want to remind the board and staff. My assistant. We have an excellent Citizens Advisory Committee that is attached to this board as part of our operations here. And in the past, they've been very generous with their time reviewing materials and seeing. They're made up primarily of people who receive services, or agency people who work with people who receive services. So they're the ones where the rubber hits the road, and they're a great review of what will work and won't work with the community.
Wonderful.
And their next meeting is August 3rd.
I think they talked to him. Did you talk to some?
Did, yes, we
Good.
spoke with a mother of one of the folks who is already kind of navigating with this system. So her conversation, I actually was one who spoke personally with her, and probably the most helpful conversation of all that we've had.
Good.
Yeah.
Good, thank you.
Thank you. They'll continue to be a fantastic resource as long as we can tap
Thank
into
you.
them.
And Linda, our intent would always be to send through materials and suggestions through that, because that's kind of our standard process, for sure.
Linda, are you all set?
Yep, thank you.
Okay, we'll go Dana, and then we'll go Donna. Dana, go ahead.
Thanks, Bill. I just want to say, I'm going to echo off what Antoinette said, and I think you guys did a great job. Thank you. But what I really like is that we're going to make it simple for people to be able to understand what our services are, be able to access those. And I really hope that while this campaign is going on, that's one of our main focuses, that we make sure we simplify it so people know what exactly they can access and then how to access that. So I'm really looking forward to that. Thank
Simple
you.
has been our buzzword in our meetings and our conversations, so thank you for
Good.
that.
I'm glad.
It's a complex system, so if you can figure out simple for us.
We're going to do our very best. We're going to do our very best.
Donna, go ahead.
Yes, I also wanted to compliment you on the wonderful presentation. I think it's badly needed, and I think you've covered a lot of different aspects that we need. The one question I have is, I noticed a lot of the concentration is on the internet and people, accessing, and we do have, believe it or not, people that don't have the internet. So I was wondering if you have any specifics of how you would be addressing, especially some of our populations, especially don't have
Yeah,
internet.
sure. No, what we love about digital is that it's oftentimes more trackable, so it gives us really good data to come back to you and tell you what's working. But we do recognize that many of our clientele, many of our community are not online, and they may prefer other avenues. So within some of the marketing mix that you'll certainly see some more traditional advertising, like billboards, like TV, like radio, absolutely a continued focus on some of those printed materials as well. We've got a lot of discussion about rack cards, so you'll get all new fresh rack cards. And so we'll always be looking for some of those opportunities to maximize that presence both online, but also in the physical as well.
Thank you.
Yeah, thank you.
Thank you, Donna. Anybody else with questions, comments, concerns? Okay, thank you both for the presentation. I have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next, I'd like to take a motion to approve items J and K, fiscal year 22-23 substance use disorder provider contract amendment and fiscal year 22-23 specialty services contract amendment.
So moved.
Motion from Megan, support from Selena. Tracy, did you have anything else to add?
It would be the same, just as a reminder, there was an amendment with the exact same changes. That's why we have to do an amendment immediately. This would be that part of it. But again, the language difference is the delegation. Does not have the OIG reference 10 years versus 8 because that's not applicable until next contract year.
Thank you. Questions, comments? Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we'll move on to item 8A, which is a receive and file. So I'll take a motion to receive and file the QAPIP report quarter 3 fiscal year 2023.
So moved.
Support.
Motion from Dana, support from Linda. Tracy, did you want to speak to this at all?
Sure, just as a friendly reminder, in February of last year, you approved, or this year, I should rephrase that, our formalized plan, right, to have a continuous improvement practices in place. This, we are required to come to you quarterly. This is your quarterly report to provide you an update. So just as a quick summary, some of the items you'll see in there is we have reinstated or rebranded, whatever terminology you want to do, our utilization committee and our quality committee, and really restructured to make sure that we're doing everything we should be doing, and there's not some negative overlaps, but some positive overlaps in those activities. You'll also see some quick updates on our KPIs, key performance indicators. They are in our contract. We are required to meet them, so we continuously monitor them as part of our quality process. You'll also see that we are required to, in the QAPIP, required by the state of Michigan, required to identify both clinical and non-clinical goals. So you'll see those referenced, and they give you kind of an update of where we're at. So basically, this is our progress report on where you're at. And then in February of next year, you'll receive kind of, here's how we did on what we said we were going to do, and here's what we want to do next year.
Thank you, Tracy. Questions? Nick?
Doesn't always cooperate. Dana, come on down. No, I got it to work now. I did notice some of the percentages were very high. Congratulations. Some were lacking, and I want to commend you that what you've done in addition to noticing where things aren't going as well as we would like is that you've got a plan of action to try to address those things. So I just want to say congratulations on that.
Yes, we're very excited about the progress, but and optimistic about the many measures being put in place to
Yeah.
ensure it continues.
Thank you, Nick. Any other questions, comments? Okay, all in favor of receiving and filing, say aye.
All right.
Aye. All opposed? Motion passes. Next is resolutions. We have none tonight. We'll move on to item 10, which is the voucher listings. I'll take a motion to pay the bills. Motion from Antoinette, support from Linda. Comments, questions on the bills? Seeing none, all in favor signify by saying aye.
All right.
Aye. All opposed? Bills are paid. Next, we'll move to our CFO update with Ken.
I think this is my last thing for tonight, so.
Don't say that. I'll call you back up for something.
I'm going to start off with an update on some of our ongoing disputes with the state of Michigan. I think I provided a similar update last time. I covered the methadone issue earlier. As I mentioned, we had a My Health Link state inpatient issue that we've been working with the state on. I have no update other than there's no update from from the state. So we've heard from some of our counterparts across the state that are My Health Link regions that it's being worked on, but we haven't received any specific communication. Same with the ISF, actually. Richard continues to push that issue. I think since the last meeting, we have not heard anything from the state. So the ongoing assumption is that we're in good shape there, I guess, as far as his arguments. I just wanted to touch on that. I know some of you have been curious about those topics, but they haven't moved much. Adding something to the list, just while I was sitting there, we have, as part of our CCBHC program, they withhold 5% of our revenue every year for quality measures. We have, I don't even know what number iteration we are on our back and forth with the state, whether we met these measures or not. There's about at least $1 million in the balance of, if we meet this one measure, I think last I heard it's 5 people to move the dial on this thing, and that will be the difference between that. But this is a fiscal 22 number that we are still trying to work on the details. I'll give a shout out to Karen Slattery, who literally like a half hour ago sent the last, here's our findings. We feel we have 15 people that meet this metric. So we'll see what happens, but I did want to make this group aware that that's an outstanding item that that we continue to work through, and hopefully it turns out positively for us. So, any questions on those topics before I move on? Okay. The other thing I wanted to touch on was rates and budget. I touched on a small piece of the rates a little while ago. We continue to get this in chunks from the state. We had a rate setting meeting not that long ago. We continue to not have our final rate schedule from the state. We're going into August 1st here. If we're lucky, we'll have it by August 15th. We have oddly had to provide feedback on the rates by Friday for what the information we do have. So didn't make a ton of sense from that perspective, but hopefully they're open to feedback on the final rates. They are looking to adjust the rates up to offset the eligibility decrease. We're just not sure what that looks like yet until we have it in hand. So as soon as I have it, I'm hoping August board meeting, I can come to you with something that's a legitimate analysis of what things are going to look like going forward. We do have a budget meeting scheduled with county finance and the executive's office tentatively for, I think, August 29th or 30th. I don't remember exactly which day. So hopefully we're presenting to them. I've got some information here in August, and then we're bringing you a full budget in September, right under the wire there, to try to get in before 9:30. So we're diligently working on expenses for the budget. So we'll have that worked out, but that's where we stand with that. Any questions on rates or budget and where we're trying to head with that? No? Okay. I'll get into the financials now, page 2. As promised last time, I added a fiscal 2020 trend line to this chart to add some context to what we have there. You can see the revenue line is kind of a roller coaster ride there at the end. I think that speaks to the beginning of the pandemic and some of the fluctuations we saw there. But the beginning part of the revenue chart, you can kind of see that baseline 2020 up until the pandemic started is where we would have been with revenue normally. Same with the eligibles. So we're expecting to come back down to that level on the eligible side at least, but hopefully an offsetting increase to revenue to shore that up. Nothing to note on page 3. Cash remains high, liabilities remain high as we owe the state. We did settle 18-19. I think that we might have just been working on that last board meeting. So we also received our settlement for the CCBHC program for fiscal 22. Our numbers differ from theirs and by about 20,000, which isn't a big deal, but we need to figure out why. So hopefully we can get that off our plate as well. Page 4, nothing to note there. The biggest changes in provider expense for our contracted services is we're recognizing full year of residential CLS rates and hospital rate increases on that side. Page 5, we continue to run surplus in Healthy Michigan as expected. Our current projected local surplus for the CCBHC program, if you add both the Medicaid and the Healthy Michigan, is about $2 million. So that's good for local dollars that we can keep and would be unrestricted. Projecting a fully funded ISF, as you can see at the bottom. Page 6, I'll highlight that our CCBHC non-Medicaid revenue sources that are specifically targeted to those folks are not sufficient, so we are running a deficit in that program. It will effectively offset with the general fund surplus that you see below that. So kind of the net of those two would be our GF lapse at this point that we're estimating. Any question on the fund source settlement sheet here? No? Okay. I'm not going to belabor any of the details on any of these further sheets except for one. On page 9, you'll see in the state facilities line, we have negative expenditures in there. The reason for that is because of what I mentioned before with our dispute with the state. We've effectively made an accounting entry to say, we don't have a mechanism for them to get this back from us, or for us to get it back from them, except for to withhold our payments on our quote-unquote regular state inpatient. So we booked a negative. Eventually the positives will catch up to it. But it does look odd on the statement, so I wanted to mention it to the group. Other than that, I think that's all I have.
Thank you, Ken. Any questions? Nick, go ahead.
Just real quick, any update on our discussions with the state about allowing a larger carry forward in light of the pandemic funds increasing, but the eligibles coming in sort of, well, you know what I'm talking about. We've been
Yeah,
trying to get
so
a little less
other
carry.
than what we've already done with the ISF, where we have an interpretation of the contract language that we can keep a much larger share of that, there hasn't been any further discussion.
There's no further update at this
Right.
point.
We do have a new PIHP contract coming up that feedback has been submitted. It's for fiscal 24, and they did change that language a bit, but I don't think it should be an issue, so.
Still in negotiations.
Yep.
Thank you, Nick. Anyone else? Any other questions for Ken? Okay, thank you.
Thanks.
Next, we'll move on to the COO update. With Tracy, just a reminder, Dave did send us all his update by email, and Tracy just has a few more things to add, I think.
Yes, mine would be short because I was like, I thought it was only a COO EO update. I didn't know whether there was a slot for me. So just as a few quick draw attention, and you do have some of this information in the materials, whether it be the workforce update or Dave's update that he sent you, but just some hot topic items. As you know, we have the conflict-free assessment and planning. You guys wrote the resolution kind of opposing it. We still have not heard anything back, but we know there's other organizations that continue to advocate for that not being in place and kind of exempting us as a governmental entity. You guys will see, I think, and thank you, Lori, for volunteering, and I know even Mark mentioned it too, is we have numerous events at this time of the year. So just like everybody has to go to graduation parties and all at this time of year, everybody does events. So we have, I think, 6 events coming up in the next 3 weeks, 4 weeks that we are participating in, either as a sponsor or sharing information, kind of going back to that marketing thing. So we show up at these events. Most of the time it's at a table type of environment, but sometimes it's other things. So if you haven't checked them out, please check them out both in the workforce update, and they'll tell you details, including like shareable flyers and things like that. But also, if it's a public event, we're trying to put it on our social media. So if you could check those out and support them, we would greatly appreciate it. And when Agnes comes up in a minute, she can tell you about hers and any details, because we're excited about the one that she's leading. The other quick update is we continue to have our DEI, or Diversity, Equity, and Inclusion survey out there. We kept it open because we didn't get as much responses as we had hoped initially. Luckily, we've gotten more over the last couple of days. We plan on keeping it open till the end of the month. After receiving that, that will be one of the factors that the organization HMA, which again, our consulting group that we've selected to provide an assessment for us of where we're at on DEI, so then we can kind of have a where we're at today and then set forth some goals so where we can move forward to the future. So if you haven't completed the survey, you were part of our group, we would encourage you to do so. And that is all the quick updates I have.
Awesome. Thanks, Tracy. Questions for Tracy? Comments? No? Okay. With that, we'll move on to other possible agenda items with Dr. Agnes Ward with her clinical department presentation.
Good evening. Thank you so much for making the time to have me present on the clinical department. I'm just going to be going over the PowerPoint presentation that you had briefly. I know you probably reviewed it. I wanted to, in this PowerPoint, showcase pictures of my team, because you're always seeing me, but you don't see the team. And I think it's really important that you see who they are. And maybe if you see them around, you may have seen the names in emails, maybe heard of the names, so you can kind of put a face to a name. But with regards to just a brief summary of the clinical department, we're responsible for all of the evidence-based practices, choosing the evidence-based practices that we implement, making sure they're safe for the individuals we serve, as well as our therapists to implement. We're looking at also, besides our evidence-based practices, our department carries out the integrated care activities. So the CCBHC, my team leads those initiatives. The My Health Link program, the Medicaid health plans, and coordinating care for the individuals as far as medical and behavioral health. We are also responsible for the autism benefit program, as well as psychological testing throughout our clinics. We also develop standards of care clinically with regards to clinical practice guidelines. We monitor restrictive and intrusive interventions. So for our individuals served who might have limits to rights, for example, limits to water intake, or they can't eat certain foods and we have to restrict their rights, it goes through a committee that I chair to make sure that nobody is harmed and that the benefits outweigh the risks of infringing on their rights. We also developed a CCPRT, Clinical Case Presentation and Review Team, there was a need to support clinicians in our system. So we developed a committee where we actually have any clinician from any agency who needs our support at the PIHP level, like a supportive case consult on cases that they might find challenging. They're not sure what to do with an individual's treatment or care. They can come through to our committee and we will set up a meeting for an hour to discuss any concerns that they have to make sure that we are serving the individual as best as we can and we provide recommendations and anything that we feel needs to happen with regards to their care as well. We administer adult block grants. So we have, through our block grant funding, we have the My Strength app, which you're familiar with. That's what funds it. The grants are Vet Navigators funded through that. We have the gardening project at multiple locations. I'm sure you have heard or seen some of the beautiful gardens that we have at some of our agencies. So that comes through our department. I also oversee our training department, the 15-mile location. So our training department is responsible for all of the trainings for our individuals. Some of the things that we've implemented is a zero suicide philosophy. So it's really looking at our practices and standards of care with regards to preventing suicide. We have implemented question, persuade, and refer, the QPR training. Our newest one is the AMSR training that is assessing and managing suicide risk for clinicians. We're also looking at updating our focused medical record to make sure that we are able to have flags for people who are expressing suicidal thoughts so that those are caught very quickly and that we take action. So we're implementing a number of different things to prevent suicide. We also have brought in some new evidence-based practices or newer updated research and information on older one. We have a solution-focused brief therapy, which is really great because we know that a number of our individuals don't stay in the system very long or they leave, so we can't have maybe a 3 to 6 month therapy. We need maybe 6 or 8 sessions to give them some skills that they need. So brief solution-focused therapy is really great with that. Of course, we have cognitive behavior therapy, seeking safety, motivational interviewing, prolonged exposure. All these therapies address different things, trauma, addiction. So we really look at a plethora of different disorders, different diagnoses, and really how we can meet the need. We're also going to be bringing in an eating disorders expert to teach a group of our staff, really have very focused eating disorder treatment sessions with the staff to teach them how to treat eating disorders, individuals diagnosed with anorexia or bulimia or binge eating disorder. We implement mental health first aid. Some of you are familiar with mental health first aid. I know Linda is for sure, Selena, Lori. This is for non-clinical staff, and it teaches people how to respond to a mental health crisis. So we've really been doing a number of trainings that people can sign up for. We also partner with the Macomb Intermediate School District and teach that to the community as well, not just internally. We are training staff on implicit bias. We have trainers in-house. I'm one of them and some of the team members, so we've brought that in-house to save on cost and be able to deliver that for individuals. It's also part of clinicians' licensure, so we want to help them fulfill that need as well. Some of the things that we also have sort of increased upon, we have 13 DCOs now for our CCBHC initiatives. We're really working on data and really collecting data and reporting around CCBHC. We do have data that support that individuals served within CCBHC reported improvement across the spectrum of life, from overall health and daily functioning to feeling more socially connected and experiencing reduced psychological distress. So we have that through surveys of individuals served. So we know that things we're doing are working. So we're really happy about that. We have our continued partnerships with our 3 medical clinics. Although we talk about My Care a lot, we also have Judson Medical Clinic and Community First. So one of my team members, Lori Doyle, goes to each of the 3 clinics and helps to coordinate care for anybody wherever they're living, to coordinate between medical and behavioral. We do a lot of community outreach activities. We go to the libraries. They frequently ask us to do a talk on a mental health topic, so we'll do that. And really anybody who wants us to come out, as well as, like Tracy mentioned, all of the different like table events. So we do a number of those for the community. And we have implemented also this Twilio talk and text reminder feature. We've improved upon that, which is reminding individuals of their appointments through their cell phone, like a text, so that they don't miss appointments. It's part of our grant funding. We've also helped assist individuals with bus tickets, funding for that, so that they can get to appointments. And some of my passion projects or projects of interest that we've recently done are, we are working with Macomb County Community College to help in their development of an apprenticeship program for behavioral health technicians, for those who are doing ABA, applied behavior analysis. As we know, the staffing is a huge shortage for the techs, so we're partnering with Macomb Community College to help them get techs so that hopefully they will come and work for our providers and we'll fill that need. So we're really happy about that. We also have the Teacher's Pet program that we've implemented, brought to Macomb County. And some of you have gone to see the graduations, which we love. It's just so heartwarming to see the kids work with the dogs. And we have kids who are now volunteering at the shelter, whose parents have said, you know, this is the best program that my child has had. They've come to me and said, thank you so much for doing this. It's so nice to see that kids are really wanting to do this and to repeat it, and they're begging to repeat it again when they can. We also developed the Children's Scholarship Fund, which I was really excited about, and I really want to thank Dave and Finance Department for letting me do this, because I have these ideas and then I go and I say, I need money. Can you give me money? You know, and they do. So far they have, and it's really this great program that we're doing. It's for kids in need. So the case managers can fill out an application, and it's basically giving kids an activity of their choice up to $350. So we've authorized like horseback riding, the autism play place. We've done a number of different activities because parents just can't afford them. So we have a little committee that we've developed that reviews the applications, and we look at the need, we look at what else they have in place to not duplicate things, and we're able to do that, so we're really excited. We also just launched, today was the second class, a 10-week art class with a professional artist, a graduate from the College for Creative Arts, and she's done a number of different professional things. She is teaching an art class for 10 weeks for our adults. So it's very professional. I couldn't even understand what she said on her 10-week description. I said, you need to make this where a non-artist can understand. So she's doing these wonderful things. She's doing like sculpting, they're doing painting. The individuals are doing like this art poetry, all of these really amazing things. So the art class filled up in, I think, 2 weeks. It's really popular, and so far it's been going well. We're hoping to get some pictures of the art that we can show you. So I've asked the instructor to take some pictures of the art that the individuals create. So very excited about that. And then the last thing, the latest thing, and I hope I can, if I may pass this around, it's our marketing to all of you. It is our fair on September 23rd that we're organizing. It's our health and wellness fair. So it is on a Saturday, 10 to 2. And this is going to be a fair for families. It's going to have, we're partnering with Macomb Intermediate School District. So you'll see food and things, items that we can't purchase, but they can. So there's a lot of fun things going on for kids. There's going to be games, there's going to be food, yoga. There's going to be a great keynote speaker who's a magician who does kind of draws a parallel between mental health and kind of being in a straitjacket, and a symbolic, very, very neat thing. We are going to have our county executive, Mark Hackle, come in to do an introduction kind of to the event. Dave's going to speak, and we are going to have breakout sessions on mental health topics for individuals and physical health topics. So like ADHD, cancer, hypertension, depression, anxiety. So it's going to be a really great event, and we're spreading the word. If you can spread the word on social media or any avenue, if you could pass some of these out. We have a ton of these. That would be really great, but we're really counting on this to be a successful event. And that's all I have for you.
Thank you, Agnes. Nice job. Great job to you and your team. I know Jeff's here in the audience. Thank you, Jeff. Anybody with questions or comments for Agnes before she runs off? Selena does. Go ahead.
Agnes, I am always in awe of everything you and your departments do. And so I don't think anybody really realizes how hands-on in the clinical support that you guys do. And so I love the idea of the scholarships. Can you share those with us? Because I know how much we do in the community, but those are the type of feel-good that really shows how committed we are to our youth and the support that they need by providing something that isn't medical, that isn't behavioral health, but it is something in that social need that they're really struggling with. So can you share when you do those, or pictures of them enjoying that activity to us, so that we can really see how much you guys are doing?
Yes, absolutely. So we do have, for example, like Teacher's Pet, we do have pictures after every event. So I do try to send that to you, and I will send you everything that we can with any of these things, because absolutely, I agree. It's always nice to see. And thank you for your interest in all of these different things we're doing.
And if you can't physically go to the Teacher's Pet program, which I have not been able to do, but I've watched the videos that you've put out, and those make me cry. Like, they're so impactful. So everything you do is just greatly appreciated. You and your team. Thank you, Agnes.
Thank you. Thank you very much.
Okay, with that, we'll move on to some reminders. We do have a Recipient Rights Advisory Committee meeting tomorrow morning at the admin building at 8 a.m. We will have our full board for August here Wednesday, August 23rd at 6 p.m. And our program and budget meeting for August is canceled. Are there any board members that have any comments, want to make any remarks? I just wanted to make note that the Board of Commissioners did last week approve the massive diversion intake center project. So that is off and running. Also yesterday, Dave, Helen, and I participated in a meeting put on by the county executive about the Safe and Healthy Macomb project, which is dealing with the opioid funds, and brought together some of our providers. Mark was there with CARE to try to get the ball rolling on that, because that was one of my issues too as we were approving this project, was getting everybody involved, everybody that could possibly help, because we need all hands on deck for this project. And what we're looking to do in years to come, when this is finally finalized, probably in 4 or 5 years, that facility will be built and our staffing crisis will be solved, so we'll be flush with staff by then. So hopefully we can make a great impact on our community in this county. So just wanted to give you that quick update that is moving forward. So anybody else answer that? Go ahead.
I already thanked Lori for tuning in, but there were still on my Facebook is the video of the human trafficking town hall I did. So if you wanted to see that, it's on there. But for those of you that already viewed and made comments, thank you so much. I really appreciate it. It's something that I've have been requested to repeat. So I know Roseville, but I'll probably do it again in Mount Clemens, because I have a survivor that wants to speak. So I think that would be even more impactful. But just continue to look out for my town halls, because they're not about me or any specific position that I hold, but it is for our village, and it takes a village to keep us safe and keep us knowledgeable. So I would hope that you would continue to just tune in because it's information for all of us. So thank you.
Thanks, Antoinette. Anyone else? Okay, with that, we'll move on to hearing of the public. Anybody from the public wishing to speak? Bruce, you know the drill.
Yeah, good afternoon. Bruce Dutton, your director for Crossroads Clubhouse. And
Angel Vice, a member of Crossroads Clubhouse.
so we just wanted to come and talk about 4 different things. First of all, if you recall, back in June, we sent one of the clubhouse staff, a clubhouse member, and one of our advisory board members down to St. Louis, Missouri for a 2-week Clubhouse International colleague training. Part of their responsibility is to bring back an action plan, and the action plan is intended to strengthen Crossroads Clubhouse. Typically, when the staff come back, they come back with 6 or 7 action plans. Over the course of the last several years, especially during the pandemic, one of the things that I like to tell our clubhouse is that we are absolutely the best clubhouse in Warren, Michigan.
And we are.
And I really thought that it was going to be a challenge for our folks to go down to St. Louis and come back with 6 or 7 things that we need to improve at Clubhouse. And they came back with 3. One was extending the work order day, which we know was an issue. A lot of our folks that come to Clubhouse, they're dependent on SMART to get back and forth to Clubhouse. The problem with SMART is that most of the buses have to be docked at 4 o'clock in the afternoon. Therefore, they have to leave Clubhouse a little bit early. Fortunately, now we have this beautiful, monstrous 15-passenger van that's parked in our parking lot now, so we can assist people in getting home. That covers item number 2, which is that we need to do better at transporting folks. So that knocks out 2 things right there. The third thing is improving our education. We have a fantastic internal education program for Crossroads Clubhouse, but one of the things that we lack is peers doing teaching of Clubhouse members. So that's one of the things that we're going to focus on over the course of the next 6 months, and hopefully we can improve on that. But I just wanted to say thank you to the board and to our administration for allowing our folks to go down to St. Louis, Missouri and come back with some meaningful information and some goals and objectives for us to work on to strengthen our clubhouse. So that was the first thing. Secondarily to that is just a couple events that are coming up, and we're going to go in order. So October 4th.
October 4th is our open house. This year is our 30th year, and it is Pearls is the anniversary. So we're doing Pearls of Wisdom. I have a save the date card for everybody, and I'd like to pass those out to you. It's from 2 to 6.
Beyond that, in October, which I know is the new fiscal year, but there's an opportunity for Crossroads Clubhouse to go to Utah for the Clubhouse International USA Conference. Why is this important? It's important because, as you know, I know Donna knows for sure, that Crossroads Clubhouse is part of the Clubhouse Michigan Coalition. Not only are we the meetings chair, but we're also the secretary for the leadership for the coalition. At the USA conference, there is a group of coalitions that come together on a quarterly basis. And because Crossroads Clubhouse is part of that coalition, we will need to go in order to be participants in that meeting. The Michigan Department of Health and Human Services is giving us a grant. The grant covers, I believe, $1,350 per person to go. Each clubhouse in the state of Michigan, there's 40 of us, will have an opportunity. Any unused grant monies will be rolled over to those clubhouses that have already registered to go. Thanks to Dave and the Michigan Department of Health and Human Services, they've already acknowledged that we are accepted for that reservation. So we know for a fact that we're already eligible for some grant dollars. We're just hoping that we can get eligible for a couple more folks. It'd be awesome if we could take about 6 folks from Crossroads Clubhouse to the USA Conference. So I keep my fingers crossed, and I hope that that happens.
So do I.
Oh, do you want to go?
Maybe.
Okay.
I think you could talk, I think you could twist my arm.
And then the last thing that I wanted to bring up is the Walk a Mile. So the Walk a Mile event that's happening September 13th, that is in Lansing, Michigan. Our administration has given Crossroads Clubhouse, or they entrust us to manage that like we have in the last several years. We already have the coach reserved for that date. We're hoping to take up to 55 people to that event. That'll go from 9 o'clock in the morning till about 3 o'clock in the afternoon. And I'm just bringing that up because I'm encouraging all of you to come and participate in that event. If you've never seen it before, it will blow your mind for sure. So we would love for you to come and attend the Walk a Mile in My Shoes, September 13th, 2023. And that's all that I have. Do you have anything else?
Well, we got a wedding.
Oh.
Just so everybody knows, Bruce is officiating a wedding August 7th, and you're all invited. It's at Crossroads.
Very good. Thanks.
Thank you both. Anybody else from the public wishing to speak? Anybody else? Any other wedding invitations you guys want to throw away? All right, seeing none, we will close the hearing of the public, and I'll take motion to adjourn.
So moved. Support.
All in favor?
Aye.
We are adjourned. Thank you, everyone. Drive safe.